This made me angry. Hello, I'm the Grumpy Gammon, and these are some of my motley musings. On the 3rd of January 2025, the Telegraph ran a story under the heading Inside the Priority NHS Services for Migrants, with the subheading Asylum Seekers Receiving Preferential Medical Treatment Despite Increasing Wait Times for Britons. This is a major story, but it broke at the same time as the government got itself into another pickle over calls for a public inquiry into the so-called Asian grooming gangs. That is, gangs of men of Pakistani heritage who systematically raped white girls as young as 11, 12 and 13. Consequently, most attention has been on that story. The Telegraph broke a big story that has been fact-checked, including by the black belt barrister. Before getting into the story, it's instructive to look at what led to the establishment of the National Health Service, because there are people who believe the NHS is a free service. Few people know that healthcare free at the point of delivery existed before the NHS was established. There were in fact many local social insurance schemes, friendly societies and welfare societies that people contributed to, as well as voluntary hospitals. There was even a scheme of contributory national insurance set up under the National Insurance Act 1911 that provided medical care, retirement benefits and unemployment benefits. It was, however, a patchwork of provisions. The Interdepartmental Committee, led by the civil servant Sir William Beveridge, had been tasked with reviewing the operation of social insurance schemes and making recommendations on ways of bringing them together. The final report, known as the Beveridge Report, was published on the 2nd of December 1942. This was under the government of national unity led by Winston Churchill when Britain was at war. The NHS was not intended to be a free service. Instead, it brought together the best of the existing social insurances into a national scheme, the contributions to which were to be deducted from workers' pay. So what is the story? Official NHS figures reveal that at least 1 in 4 people had to wait more than 4 hours to be seen in A&E in November 2024, and more than 45,000 patients had to wait longer than 12 hours. Yet, at the University College London Hospital, some people are given priority and can get assessed in just 15 minutes. I'm not talking about members of the Politburo or people who say they support Palestine. No, that privilege goes to undocumented migrants as well as the homeless and drug addicts. Patients within these categories needing an urgent assessment can ask for an appointment. You heard that right, they can ask for an appointment at A&E and be bumped to the head of the queue on arrival. After initial tests, they are taken directly to a consultant for a more thorough evaluation. Since when was A&E an appointment-based service? The UCLH scheme is just one of several schemes set up across the UK, focusing specifically on helping illegal migrants to get better access to healthcare than many tax-paying British citizens can do. In South London, for example, special walk-in services at community day centres are available for refused asylum seekers and undocumented migrants. Here they can receive a full health assessment, treatment of minor illnesses, and referrals to specialist services. In contrast, in November 2024, 15% of locals had to wait at least a week before seeing a doctor. A week, that's a luxury. You have to be lucky to see a doctor within 4 weeks at my local surgery. In October 2024, residents in Nottingham were enraged because the council ring-fenced £684,000 of funding for specialised healthcare access for asylum seekers and refugees over the next 5 years. In that same month, a GP surgery in the city closed because of a lack of funding. Guy's and St Thomas's Hospital in South East London offers a dedicated refugees and asylum seekers services in Lambeth and Southwark Those who can benefit from the service include undocumented migrants and asylum seekers who have been refused the right to live in the UK. Many of the services listed on their website resemble those that ordinary Britons routinely wait weeks to see their GP about. I was shocked to discover that some of these schemes have existed for 23 years. That's back to the days of the Blair government. The prioritising of illegal immigrants over British citizens has continued under all successive governments, including the present administration. So is it fair that those with no right to live in this country are given a priority service in healthcare? In my view, this sums up broken Britain. The NHS should not be prioritising diversity over healthcare. The only prioritisation in healthcare should be on the urgency of the need for medical treatment. Let me know what you think in the comments below. And by the way, the petition to suspend all immigration for 5 years now stands at more than 200,000 signatures.